I had suffered with my own health, and I had believed in the past that I didn't need to go to the doctor until something took place. I ended up being pre-diabetic, and it made me to start exercising, go to the doctor more regularly, and lose some weight and eating the right food. It's very important for men, especially African American men, to be checked out because as statistics tells us, 5 out of 8 men would not go to the doctor. That's a big number for us not going to the doctor to make sure we're all right. In order to know how our health is going to be, we got to be checked out to prevent these issues going in our body. So I'm really about how do we stay more healthy as a pastor leading the congregation, in the congregation working together. We have to move away those fried chickens, that sweet tea, drink a lot of water, do some walking and a lot of exercise. So I truly, truly believe we need to get more men into their health so they can live more longer.
Hello, I'm Jessica Stokes, and I co-lead faith-based initiatives at Blue Cross NC, and I'm privileged to be at the Men's Health Screening and Breakfast here at the Beyond Blue Neighborhood Center with Blue Cross NC. Very grateful for our collaboration with Churches Outreach Network and Dr. Rodney Coles. Pastor Coles is a longtime friend of mine, and the work that he does around health, preventative health and chronic disease and overall health for all people of all ages is truly inspiring, and we're just so proud to join the work that he does. And so please know that Healthy Blue, our Medicaid segment, and Medicare, and our FEP, Federal Employee Program, and our commercial segment, we all are working towards better health care for all, and that certainly includes men of all ages and all backgrounds.
I'm so excited to be here today to talk to the community about men's health. We know that men don't go to the doctor very often, they don't get their health screenings, and subsequently they die sooner than women. So I'm here to encourage men to find a doctor, go to the doctor, and make better healthy life choices.
My name is Valerie Walker. We are at a men's fellowship breakfast, and it is wonderful to see men coming out to get their screening. This is what today is all about, knowing your numbers and making sure you live a healthy lifestyle, along with learning how to eat right, learn how to take care of chronic diseases, but the main thing is you are here and we are grateful to have you.
Our initiative each year to focus on men's health is one of the most important things that we do. So many men go about so many things, work, family, children, that taking care of ourselves often is always put on the back burner. And so today is one of those times when we bring together health care providers who are able to give us the tools. Knowledge is power, and we're hoping that today will be an inspiration, especially for men, to be more mindful of taking care of themselves. We are God's creatures. Our life belongs to God, and we return that gift, and we are called to live life fully as Jesus tells us.
My name is Eddie Godley. I'm with the Interfaith Clergy Chaplain Program, and I'm here today supporting the men breakfast. The men breakfast help screening also, where men can learn about the help, make sure everything is up to par. Pastor Cole always doing something in the community to help men, to help others to prolong their life and to have a healthy life. We got organization out here that's checking your blood pressure, checking your sugar level to make sure that you're on the right road. If not, you can get the help that you need. This program and breakfast is well needed, especially for men. Men kind of don't like to go to the doctor, don't like to, check their health and things. But this program, this breakfast this morning, will help us to learn more about ourselves. They got a speaker coming in from ECU, I think, to come in and help and educate us on our health, what we need to do to continue to be healthy as men. So, I'm glad to be a part of it. Looking forward to the breakfast, looking forward to all the information to help me be a healthy man, so I'll stick around for my family and be a resource for the community.
My name is Mary Nyangweso. I am a faculty member at East Carolina University, and I'm here today to talk about faith and healthcare. We believe that faith has a lot to teach us about healthcare. There's so many religions that tell us what to eat and what not to eat, how to treat people who are sick, and how to care for everyone else. So I'm here to do a project, and the project is trying to understand what communities are doing to help, promote a healthy lifestyle. All right? I'm here at an event right now where a church has organized an event for men to be screened for possible health issues that they have. And this is really fascinating to know that churches and other congregations are doing a lot to try and educate people on how to be healthy and how to live a good lifestyle. So it's a great opportunity for many congregations or many communities to know that if you talk about health issues, maybe members within your community are going to listen and learn something and do something about their health situation. We struggle in various communities with issues like mental health, with issues like blood pressure issues, diabetes issues, and many more other issues. And it's important that we learn how to manage some of these. If we learn how to manage them, we probably don't need to see a doctor, because we would have educated ourselves on why we are suffering from what we are suffering and how to stay away from certain things that are making us sick. Religions such as Judaism, they have kosher meals. They tell us what to eat and what to stay away from. A religion such as Islam tells us what to eat and what is haram, as a way to try and educate us. Stay away from this food, eat this other food, because it's going to be more healthy for you. And so there is a lot to learn. And so I welcome you to this project, and I hope that you can learn something and share the message with the members of the community so they can learn from this project how to live a healthy lifestyle. There's so much to learn, and I welcome everybody.
I believe that intersection of faith and health care is essential in the day and time in which we live. Christ Jesus came that we might have life, and that more abundantly. And so abundant living is beyond just our spirituality, but taking care of the total person, physically, mentally, emotionally, and spiritually. A lot of men, they're active in their churches and they're not afraid to come to church, where there's some type of fear of taking care of their temples, which is their bodies. And so the intersection between faith and healthcare is essential, especially in communities of black and brown people where they may not have access to healthcare, but they do attend church on a regular basis.
Yes, I'm Reverend Richard Joyner from Conita Baptist Church and Conita Family Farm. Yes, faith, health, and food is an intersection in how we are doing this. And the scripture says that my prayer and desire is that as you are spiritually healthy, that my desire is for you to be physically, holistically healthy.
I'm Catherine, and I'm a registered nurse, and I have the joy and the honor to be one of the presenters today in the Men's Health Symposium. We're really, really excited to bring men together and have them have an opportunity to learn more specifically about men's health, to take an interest in that, to get some information, some takeaways, and some very practical things to do on a daily basis to help improve their health. Some men have never even had their blood pressure checked or their blood sugar, and this is going to be our opportunity to do that. And I'm hoping that when I present on hypertension and diabetes, that there will be some great takeaways that will be foundational to the rest of their life for building their health for longevity.
So thanks very much for being here. And just to tell you a little bit about me, Representative, I don't know if I promoted you or demoted you. Reverend Coles, I represent Pitt County in the North Carolina House of Representatives, and that's one of my jobs. But my main job is I work right down the street at the emergency department. And so I think I'm here more from my role as a doctor than it is from a legislator. And what I say to my patients all the time and their families is, I hope I never see you again as a patient. Not because I don't want to see them, that I don't care for them, but if you end up in my emergency department, that means you've had a bad day, okay? And I don't want to see anybody there, because we have a few patients who show up because they like the social interaction, but not many people get up every day and say, today's the day I feel like I want to go to the emergency department, okay? So what my goal here today is to talk to you about why your health is really important. And so I'm going to ask a couple questions, nothing too personal, but I want to just get started. How many of you in here have a doctor that you see regularly? Awesome. Very good. How many, this is a well-informed audience. How many of you seen them in the last year? All of you. Okay, I'm done. So I'm preaching to the choir. But what I do know is that too many men in particular don't go to the doctor. And so my question for you is, why is it that we men don't go to the doctor? Why is it you think it is? Fear. Fear? You don't want to find out, right? Blissfully ignorant. And what else?
Economic for some people.
Economics, right? We don't have insurance, there's a cost, all real things. Why else? Manly man, right? Don't need it. I take care of myself, right? Sometimes we're stubborn, right? The women in the room, you'll agree with that, right? And what we know is that if we look at all men, only about 60% of men get regular visits. And we know that women go much more frequently than what men do. Okay, And that's to our detriment, because women get the screenings, they get checked out, and they live longer than we do. And we don't, there's nothing in biology that says that we have to live shorter, but when we don't go, when we don't get our regular health care, that's why we die sooner. And one of the challenges, a lot of the diseases that affect us don't have any symptoms. Things like hypertension and diabetes and heart disease, there's no symptoms until you do, until you show up and you have a stroke, okay? So one of the questions I ask sometimes my patient is about why men die sooner, and you've talked about some of them. What I like to say is that men die sooner so we can get some peace and quiet, right, from the women in our lives. And when I say that, then I look to the women who often are the women who bring doctors to see me in the emergency department. It's oftentimes that the men have been complaining and complaining and complaining, and the woman in their life finally gets tired of them and said, we're going to the doctor. Okay, so for the women in the room, thank you for what you do. Because if it wasn't for you, you would get rid of us sooner. Okay, and because of your persistence, it's so important that making sure that the men in your life come in. The other thing that we know and why it's so important for men to get screening is men have higher incidences of heart disease, diabetes, cancers, strokes. The other thing is suicide that we don't talk a lot about in men. And what I know, old men in the South are the most successful with suicides. And it has to do with loneliness. It has to do with our fear or unwillingness to admit that we have an issue. And so that's one of the things that's really important that we don't often talk about in men, because depression is a real thing, substance abuse is a real thing. And those are things that, because we don't talk about them, because we don't go get screening, we're more at risk. And so there's so many reasons why I think it's important for you to go in. We talked about high blood pressure and diabetes. Those are really important factors. What do you think is the single most important thing that you can do to have a longer life? Exercise?
Healthy diet.
Healthy diet? Good ones? Yeah. Anybody still smoke in the room? I won't make you put up your hand. Smoking is probably the single biggest thing that you can change in your life that will give you a long life. Okay? Diet, exercise is important. Smoking has so many bad things, so hopefully in this day and age, people have gotten away from that. But that's really important. And you mentioned exercise, and I'll just tell you, I'm going to tell you what we should do, not that I live it very well, right? We all are sinners, we're all trying to get better. And I stress eat, and so when I started this role, I've gained my 20 pounds, and it is still following me, and I haven't been able to get rid of it. So the things and why it's so important for you to get screenings, wherever it is, if it's here, if it's at your doctor, if you have a workplace, hypertension, high blood pressure is a really important thing that doesn't have any symptoms. And we know in this area in particular that hypertension is one of the leading causes of why people have to go on dialysis. Anybody know people who are on dialysis? Okay, so dialysis, when your kidneys shut down, your kidneys regulate all the fluid in your body, your chemistries and things like that. Untreated hypertension is the most common cause of diabetes, and we have tremendous disease burden in this part of the state. When you're on dialysis, you get to spend 3 days a week hooked to a machine through a needle in your arm for 4 hours a day, every 3 days for the rest of your life, for the most part. There's other ways. Sometimes you put a tube in your stomach and you get dialysis, but that is completely preventable, and it's completely devastating for people because it makes it really hard to keep a job, to have spend time with your loved ones. So the way that we prevent that is to get your blood pressure checked. And you can do that at home. You can do it at your doctor's. You don't have to wait. You go to any drugstore, and probably we could ask our Healthy Blue person. If you're on insurance, many insurance companies will actually pay for you to do that. You keep a log, and then, oh, you're right in front of me. And that's a way that you can get screened for high blood pressure. For diabetes, it's a single finger stick. Okay, so things like that are really important for you to do, because with those diseases, you might not have any symptoms until you have a big stroke, and then you can't talk, you can't walk, you're put in a nursing home. So that's a really important thing. The other thing that we know what's really important that men do terrible jobs on are getting screening for cancer. right? So I'm looking at the room. I think most everybody is in this. You might not, you're kind of young. Has everybody had at least one screening colonoscopy in your life? Several? Okay. So probably one of the single most important things for men is to get your colonoscopy. And it's actually not bad. The worst part of it is taking the prep, cleaning out the intestine. But if you don't get screened and we don't find it early, your likelihood of dying of it is much higher. And if we catch things early, we can treat them very easily, okay? So colon cancer is really important. Nobody's smoking here, so that's good. I suspect a few of you in your younger wild days smoked a few cigarettes, okay? So screening for lung cancer is also very important, which is very easily done through your doctor. And the other one that we talk about, particularly in men for cancer screening, is for prostate cancer, okay? Prostate cancer is another one of those diseases. If we catch it early, then we can treat it very easily. Sometimes medication, sometimes surgery, but it doesn't often kill you if we catch it early, okay? Now, why do you think men don't want to go get checked for the prostate in particular? Yeah, the type of test. So we can do a blood test, but the other thing is you get a finger in your bottom, okay? And you need both. You can't just do one or the other. So if your doctor says, well, let me just do the blood test, they need to check the backside, okay? And that keeps a lot of men from getting that screening. Again, that is completely treatable if caught early, okay? So we talked about blood pressure, heart disease, diabetes. We talked about a lot of dietary responsibilities for that. We know that if you're overweight, that is the primary risk factor for developing diabetes in an older person. We talked about cancer, and then we talked about mental health. And I think for men in particular, this is a really hard thing for us, right? Because we're enculturated, we're taught you have to be strong, you're weak if you have these feelings. But what I know is that because men don't talk to their spouse, talk to other men about this, this is a really difficult problem for us to treat. Depression, substance abuse, anxiety are all incredibly well treated. It doesn't take a lot, but what you as men and what the groups that you're on, you need to talk about it. And so when I asked before who all has a doctor and everybody raised their hand, so that's great. But what I challenge you to do is when you go in your groups, whether it's your golfing buddies or the playing cards or your church or whichever group that is, I'm going to challenge you all to have some of these conversations, to ask these very simple questions that aren't bad. Hey, do you have a doctor? If you don't, hey, I've got one. He might take you on as a patient. Where can we go? So that's going to be one of the challenges for you when I leave you today. The other thing that routine screenings can do for you, I know you might have heard a little bit about in the news about vaccines, but what I'll tell you is that there's really effective, good vaccines that you all, as I'm looking around, should be asking your doctor about. When you get a little bit older, getting the vaccine for pneumococcus, so that's a very common cause of pneumonia, the lung infection that causes death. So getting that, a shingles vaccine. I don't know, has anybody had shingles before?
No vaccine.
You've had the vaccine. Anybody had shingles?
No.
It is not fun, right? It is a type of pain that you can't imagine. So shingles, it's the old chickenpox vaccine that you get when you're a kid. It lives in your brain, in your spinal cord, and then sometimes it pops out and it gives you this bad rash and it hurts like the dickens, okay? So that can be prevented. So getting those vaccines is really important. And then talking to your doctor about how can I help make good lifestyle choices. If I have difficulties with picking right food or dietary, can I meet with a nutritionist? Is there somebody in the practice who I can talk with to help me get some of these screenings? One of the things that we know as you get older, depending on the insurance company, some of those plans will actually pay for your gym membership. Okay? So asking about some of those things that you might have already paid in for a long time that you have access to. The other important thing to have a good doctor, to have a primary care physician or PA or NP, is that I know in particular for men, sometimes these conversations are hard. It's hard to talk about what's ailing you, what's bothering you, what you're feeling. And in the way that those relationships with your providers help is that they become a trusted friend. And the first time you go in, you might not tell them about everything that's bothering you. But as you build that relationship, just like anything else, just like when you're dating, when you develop that relationship, it's easier to talk about those hard things. And so that's why it's so important to get on a regular schedule for doing this. The other thing that I mentioned before is we know that when we catch diseases earlier, they're easier to treat, they're more successful, and they're cheaper, okay? So all of you, if you've got insurance or not, there's always a cost for doing this, both emotional but also financial. If you can get it caught and treated earlier, it's going to be easier on your pocketbooks, okay? So I think I'm still doing okay. So the challenge I'm going to have for you is a couple. When I talk to you about finding a friend, talking to them in your groups about this, make sure that you're making your annual appointment. So I was glad that everybody had it. I'm glad that everybody had their regular visit. Sometimes it's easier if you put a time around when you're going to do this. So if it's your anniversary, which some of us, I have to take my ring off to make sure I remember my anniversary date. So I've got it on there. But if it's a birthday, it's an anniversary, or some memorable time, that should be your trigger to make sure that you make that appointment, okay? Some of you may have the ability to go to your workplace to get a blood pressure screening or a finger stick or something like that. Your employer is paying for that, so you might as well use it, okay? So that's another important place. And then community events like this. I know that they're going to be doing screening. I'm not sure what all they're going to do to you today, but they're going to do something, I think. Make sure you show up, okay? And then for the women in the room, be persistent, because I know that men are stubborn, and right, amen to that. And so keep honest, because as I said, I see in my clinical practice so many times that it's the women in the men's lives that drag them there against their will. Not literally, but figuratively. You know, they wear them down. And that's really important, because you know the men in your lives better. And so when they're not doing well, it's up to you to help get us in. And so that's my message to the women in the room. And for you guys, tell your girlfriends that they need to get us in. So the message that I want to leave you with, and again, I appreciate, and I'm happy to take some questions as long as you'll have me until you kick me out. So the call to action is, you've all got doctors, so that's great. Make sure you're making your annual visits. Make sure that you talk to other men about what you found, what you've done, because when you talk about it, it becomes less worrisome. It normalizes that conversation. So not just in your family, but in every group that you're in. And I know that this group, because you're associated with Pastor Coles, you guys are plugged into a lot of different places. So use that. And I think sometimes we're stubborn, we've acknowledged that. But what will maybe motivate you to go in is think about the other people in your lives who are important to you. Your spouse, your children, your grandchildren. Any great-grandchildren? People have great-grandchildren? Any great-greats? Great-greats? Not yet, okay. I'm still working on that. So those are the people in your lives that you should think about when it becomes hard, when it's challenged. You say, I really don't want to go. I don't want to get that blood drawn. I'm worried. We talked about the fear. I'm worried about what I'm going to find. Well, imagine that you're not there for those birthdays and weddings. Let that motivate you when you're thinking about your own health. Because if you want to be selfish for your own, but there's people in your lives who love you, and do it for them. So I would encourage everybody to make sure that they're thinking about it. If you don't have an appointment set up, go ahead and do one now, or think about it, write yourself a memo or message to say, call the doctor on Monday and let me get in for a visit. So again, I want to thank you very much for being here. I think that's really important. The fact that you guys came out on a Saturday morning is remarkable. And then when we get done, the hurricane's coming, go get your bread and water because it's going to be gone on Sunday. So I'm happy to take some questions, but I'm also, I don't want to run over, so I know that the pastors keep us on track. So,
Do I have any questions?
Scott, one, Dr. Reader, being a doctor and part of the legislator,
Yeah.
how do you see healthcare in the rural area being managed in the face of all the healthcare costs? I know preventive care is important,
Yeah.
but access is important as well. How do you see that
Yeah.
working out?
It's a huge important issue, and it's funny, this morning I was working on an editorial about rural healthcare, because we know that in general, healthcare is a challenge, but it's worse in rural areas. So people die sooner, they have strokes, they have much more disease burden. We need to fix access in rural healthcare. And the economics of it makes it really difficult in rural areas to have hospitals and doctors, because it's hard. And if you're in Raleigh, or you're in Charlotte, or you're in Durham, there's hospitals, there's doctors all over the place. We've done a number of things in the General Assembly to help get access in rural areas. So scholarships for resident physicians who completed their training, for nurses, for pharmacists, to place them in rural areas. We're working on a plan right now to figure out how we can get money from the state to rural areas, because the economics just don't make it viable. It just doesn't. And so I believe that the state has an obligation to our citizens in rural areas to help provide that. And so that's what we're working on right now.
Dr. Reader, is it true that our state is losing a lot of money with the bill that was passed in Congress about cutting Medicaid money, when just, what, 2-3 years ago, you were serving?
Yeah.
When I was part of Care for Carolina, the state initiative to work with our legislators and faith-based leaders to get Medicaid, which finally was 500,000, 600,000 people. To Robert's point, as our representative, as you are ours, what can you tell us that we can do to support a voice like yours as a doctor for people to get the help they need?
Yep.
Does that make sense?
No, it makes total sense. And I'm trying to figure out how deep in the weeds, because I'm sure, I'm not going to stall till the food's ready, but many of those changes related to what the federal government passed won't take effect for the next year or two. I think for Medicaid expansion, so you're talking about Medicaid expansion, we, like a lot of other states, and we've got 600-some thousand people on it. Most of those changes are not going to be nearly as drastic or dramatic as some people will say. And so I don't want to be political this morning. The Democrats would say this is the end of civilization, it's going to be horrible, and thousands of people are going to get tossed out. That's not quite accurate. The Republicans would say this is a no big deal, and we're just working on able-bodied people. That's not the truth either. It's really somewhere in the middle. I think that for the state of North Carolina, we're going to be able to manage through that without too much difficulty, okay? And again, that's going to happen starting in 27 and for the next 5 years. So I'm not as pessimistic about those changes. I think it's going to force us in the state and other states to be more critical of what we're providing in Medicaid. And so what my goal is to make sure that the program is efficient and effective. Because I know that there's, I haven't been in the government very long, but what I found out is that we're really good at spending money, but we are not good at all at making sure that the money that we spend is used efficiently and effectively. And so what this is going to force us to do is to relook at what we're doing. And so that's my goal, is to make sure that every dollar of your taxpayer dollars that you're giving us, that we spend it wisely. And so that's the more complicated answer for Medicaid. It's going to have an effect, but I'm hopeful and believe that we can manage through this without too much difficulty.
Thank you. So you don't expect that more rural hospitals than the 10 that have closed over the last 10 or more years will be happening, because I serve now churches in rural areas, and like Bellhaven.
Yep. So I'm very worried about more hospital closings. Okay. Medicaid is a piece of that, but it's not actually the biggest piece. So we need to do things to help stabilize rural healthcare, rural hospitals. One of the challenges, again, I don't want to get too deep into this. If you live in Charlotte and it costs you more to run a medical practice, the government Medicare, we pay more for the same service than if we do in Tickpike, North Carolina. And I think that that's not correct. We need to flip that. We need to say, we need rural health care. If we can pay more for rural areas, that's one way with which we can do it. And so we're working on a way with which to fund some rural health care.
Thank you very much.
All right, I get one question, I'm going to be done.
We have one question about.
Yes, sir.
I think you asked my question already. My question was then, is there a doctor shortage? Because a friend of mine went to go to the doctor.
Yeah.
His appointment is in 2026. It's like 6 months from now. So is there a doctor shortage in this area?
There is, without question. And there's a doctor shortage nationally. There's a doctor shortage in a lot of North Carolina, and it's mostly in the rural areas. And so there's a big doctor shortage. And so some of the things that we're doing, the Brody School of Medicine, pointing that way, right up the street, we're under construction for a new building. Right now we have 80 students a year, and that's because we have 80 chairs in our classroom. When we get that new building, we're hoping to get up to 120 students a year. So 40 more students every year times 4 years, that's a lot of students. So there's talk of there's going to be another medical school open up in North Carolina in Fayetteville. It's a private medical school, and there's talk of the state opening up another medical school because we know that there's a shortage. That's a long process to get people into practice. So we're working on all sorts of things to try to get that. The other thing that I know is that in medical practices, there's a lot of administrative burden on physicians. There's a lot of paperwork that takes us away from patients. And one of the things that I've been talking about with Blue Cross Blue Shield and the other insurance companies is, can we reduce some of that burden, that administration, that paperwork? Because if we can get rid of 10% of that paperwork, which is not a whole lot, if you've got 10 physicians and you get rid of 10% of that paperwork, you've got a whole nother person without hiring, without training. So we need to make the practice more efficient and get rid of some of that paperwork that, it is through all areas. It's in hospitals, it's doctors, all of that. If we can do that, that will help that shortage as well. So, again, thank you very much for.
Thank you.